Hello! In today's video I'm going to be talking to you about baby blues and postpartum depression, so you know what signs and symptoms to look out for, how to differentiate between the two things, and what to do if you're struggling to deal with your thoughts and feelings after you give birth. If you're new here, welcome. My name's Anja. I'm a hypnobirthing practitioner and mum to a little girl. On my YouTube channel you'll find educational videos and relaxation audios to support you through pregnancy, birth and motherhood. So you don't miss my weekly videos, please consider subscribing and clicking the bell icon so you'll get notified when my next video comes out. Baby blues affects up to 80% of women after they've given birth, and it can last 10 to 14 days postpartum. The most common symptoms are feeling emotional, irrational or overwhelmed, and you might also find yourself crying, usually without knowing why, being generally irritable and moody, but also feeling a bit down or anxious. Baby blues is said to be caused by your hormone levels. After you've given birth, your body experiences a sudden drop in the hormone estrogen, and that can lead you to feeling very emotional, like a bad form of PMS. Also, due to the huge responsibility that comes with bringing a baby into the world, no matter how positive your birth experience was or how much love you feel for your baby, getting used to this major life change can feel really overwhelming at first. The good news is that baby blues normally disappear within a couple of weeks. However, during this time, it's really important that you rest as much as you can, that you take things slowly, one day at a time, and if you're happy to have visitors around your house, perhaps they can do something to help you, like go shopping, do some cooking or some cleaning. And that just takes any pressure off you so that you can rest and recover after birth, and you don't have to think about all of the household tasks that you need to get done. Postpartum depression, on the other hand, may initially feel like baby blues, but over time you find yourself obsessing over lots of things, constantly checking on your baby, unable to relax or fall asleep, and you may also find that you're really anxious and feeling very disconnected from yourself, your baby, and the rest of your family. You may also feel that you're unable to function normally, and these symptoms become very problematic for you and very intrusive. Women who are struggling with postpartum depression often become very isolated. They stay at home all the time, they're afraid to socialise with other mums, and they may also feel ashamed or worried about communicating how they feel and talking about their problems. So that's why if you think that you're struggling with postpartum depression symptoms, that you seek immediate assistance, communicate how you're feeling with a healthcare professional for the sake of your well-being and your family's well-being. If you develop postpartum depression, the symptoms will normally occur within the first month after giving birth. Women I know who have had postpartum depression describe it as constantly worrying about their babies, worried that something terrible was going to happen. They were constantly crying and completely unable to shake off a feeling of extreme anxiety, overwhelm and sadness. No one knows exactly what causes postpartum depression, but it can be linked to stress or complications during pregnancy, complications during childbirth, and a history of family depression. Fortunately, postpartum depression can be treated effectively with psychotherapy, medication, individual counselling sessions, and group therapy sessions with other mums. So if you think that you're experiencing symptoms of postpartum depression, please get in touch with your healthcare provider ASAP so that they can step in and guide you towards the best treatment options. By talking openly about your feelings, you're not only helping yourself and your family, you're also helping other mothers to speak up about their experiences. And this raises awareness of postpartum depression and the need to develop the best treatment options to help people that are struggling with this condition. Please don't suffer in silence or try to deal with things all by yourself, because postpartum depression can escalate if left untreated. So if you're watching this video and you do think that you have postpartum depression, don't hesitate to contact your doctor as soon as possible. Thanks so much for watching this video today. I hope that you found it useful and informative. If you've got any questions about postpartum depression, please leave me a message in the comments section beneath this video and I'll get back to you as soon as I possibly can. And if you're watching this and you're pregnant, one of the best possible ways that you can significantly reduce your risk of developing postpartum depression is to do a hypnobirthing course. Scientific research has shown that hypnobirthing mums are far less likely to develop postpartum depression because they're so well educated and prepared for childbirth. And when you're well educated and prepared for childbirth, you're far more likely to have a positive birth experience rather than a negative experience. Negative and traumatic birth experiences do increase the risk of you developing postpartum depression. So if you would like to sign up to my next free hypnobirthing taster session on Zoom and find out more about hypnobirthing and decide whether it's the right birth preparation method for you, please click the link to my website in the video description below and you will find the link to sign up to my next hypnobirthing taster. Take care and see you in my next video.